Welcome, everyone. I'm Laura Sauser. I'm the Executive Director of the Wisconsin Library Association. We're so happy to have you with us today for Public Libraries and Healthier Communities. Before I introduce our speaker, just a couple of announcements. We have some conferences coming up. We have the Wall Conference is coming up April 20th through the 22nd. The theme is Open Minds, Open Doors. It will be at the Sheraton in Brookfield. The WAPL conference is May 11th through the 13th. That will be at the Ingleside in Waukesha. Both of those conference committees have sent out calls for proposals. So put your thinking caps on and please submit a proposal. We'd love to hear from you and have some really great sessions at this conference. Library Legislative Day is on February 8th. Hopefully you've all registered for that event. We'll meet for breakfast in the morning at the Marriott Concourse Hotel, downtown Madison. Governor Evers is going to give us a welcome. And then we'll head over and meet with our individual legislators and have a great day of advocating for the library sector in Wisconsin. So before I introduce our speaker, I do have everyone muted, and please keep your cameras off. We do have the chat button at the bottom of the screen. If you would please, if you have a question as we go along, go ahead and type it into the chat and I will share it with our speaker. And with great pleasure, I want to introduce you all to Bobby Newman. Bobby is the Community Engagement and Outreach Specialist at the National Network of Libraries of Medicine, where she helps public libraries meet the health information needs of their communities. Bobby currently serves as a member of the Let's Move in Libraries Advisory Board and on the Information Technology Policy Advisory Committee for the American Library Association. With that, I'm going to turn it over to you, Bobby. Go ahead.
Thanks, Laura. Thanks for such a great introduction. We did have a name change recently, so the NNLM is still accurate, but we are the network of the National Library of Medicine. And those of you who may have seen me present at conferences or things before may be familiar with our old name, which was the Greater Midwest Region, but in our new cooperative agreement, which started in May of 2021, we are now Region 6. And so I am going to go ahead and turn my camera off while I present. It's a little distracting to me and maybe to you. As Laura said, I'm the Community Engagement and Outreach Specialist at the network of the National Library of Medicine, Region 6, and our office is housed at the University of Iowa. So I'm here in Iowa City. So a little bit about me. It's my job to ensure that public libraries in our area are connected with the resources that they need to provide the health information, programming, and services their community needs to be healthy. We do serve a 7-state region, which includes Wisconsin. My background is in public libraries. So this picture here is the old Carnegie Library in Mount Pleasant, Iowa, which is where I'm from. And I actually worked in that library for a couple of years in high school. It is now an extension office, I think, for Iowa State University. And they have a newer building that they were able to get a couple of years ago. Actually, I have a miniature of this on my desk. My parents bought it for me when they were doing some fundraising. So it's kind of a neat little link to my very long service in libraries. So a little bit about who we are before we get started. As I said, it's Region 6 for the network of the National Library of Medicine. And we are way down the chain from the National Institutes of Health. So what this looks like is the National Institutes of Health, which is the nation's leading medical research agency. Right now, you're probably most familiar with the National Institute of Allergies and Infectious Diseases, where Dr. Fauci works. There are 27 institutes within the National Institutes of Health, and one of which is the National Library of Medicine. It is the world's largest biomedical library, and it maintains and makes available a vast print collection. And it also produces electronic resources such as Medline Plus and PubMed. Then NLM is the network of the National Libraries of Medicine, and it is the outreach partner of NLM. And basically it's comprised of 7 regional offices or RMLs across the country. And our region, which is Region 6, serves Illinois, Indiana, Ohio, Michigan, Minnesota, and Wisconsin. As I said, prior to this, we were the Greater Midwest Regional Library. So I kind of want, excuse me, my apologies, I have a little bit of a cold. I want to get into part of why I'm here today and what I'm hoping to talk to you about, and that is health information and healthcare today and why it's important in libraries. So this presentation is what I started giving this presentation probably almost 5 years ago. A lot has changed about health information, and I think how maybe librarians see themselves in relation to it. But a lot of the reasons are still the same. Patients are really expected to be more involved in and to make more decisions about their own healthcare issues. So the old way is doctor knows best. And you may see this approach often in visits with your parents or other people, older individuals, or maybe yourself, that when you attend the doctor. And the new way is that we're supposed to be more involved in our healthcare choices. We are required to make choices about their insurance. It was just time for me to re-up my vision, and I spent a good amount of time trying to compare plans and figure out which was the best choice for me. And so that is very complicated. Similarly, when you make an appointment for healthcare, you may need to make a choice. Is it okay if you see a nurse practitioner or a physician's assistant instead of an MD? A lot of us probably don't know the difference between those. We're expected to know about our own health and what's happening with our bodies. We are also expected to be actively involved in managing chronic diseases and other potential issues in our health. We've certainly seen that during the pandemic. And as medicine has advanced, there have been increased variety in treatment options. And so there may not be a one size fits all for treatment for all healthcare needs. And what we've seen at the same time is doctors are spending less time with patients. And we know, especially right now, that hospitals and other healthcare organizations are understaffed due to the pandemic. This is a really interesting information about how people find health information online. And this is from a Pew report that's a couple years old, but it's still really relevant. And this actually health might be the most popular subject searched online right now. But at the time it was second only to local events and organizational type things. So people looking for things to get out and do and connect with their community. 8 out of 10 health searches starts with a search engine. So Google, Yahoo, whatever people are using for their search engines, they're not starting at vetted health websites. And as we know, Google brings back different results for different people. Google includes ads and other types of sponsored content as part of responses to searches. Less than a quarter of people who are performing these searches actually verify the date or the source of the information they encounter. So they're just looking at, say, maybe the first couple hits. If that information concurs, they move on without trying to suss out where it came from. And then more than 25% of people searching for health information hit a paywall. So they're coming across articles or other content that is hidden online behind a request for money or access to a credit card. This was really startling for me. I mean, this is again from some of the same reports, but 9 out of 10 adults have difficulty using the health information that they encounter every day. And that's really true because we're bombarded with health information. At no time more true than right now, and especially at a time during like the pandemic, when what we know about the coronavirus, COVID-19, is changing regularly. The recommendations we've seen have changed a lot over the last couple of years. I know personally, I spent between March of 2020 and August of 2020 sewing and donating fabric masks to hospitals, senior care facilities, daycare facilities, people in my community, my neighbors that needed them. I think I did about 1,000. And now they're saying that those are no good, right? So we're getting this different information as we learn more about how the virus spreads. They're still better than nothing, but your best choice right now is an N95 or a KN95. But let's look at a little bit of lighthearted information. So I like to show a couple of reasons we struggle. This is ads. Ads are one of the reasons that we struggle understanding the health information we see every day. I don't know what your foreplay looks like, but this is not what mine looks like. Definitely no bathtubs on a hill overlooking the ocean. And so this ad is selling medication for erectile dysfunction, but it is framed in a way that really has nothing to do with the issue it's addressing. And taking it won't magically transport you to an Italian hillside overlooking the ocean. This is another cute one I came across. Basically, the idea was that if you were sniffing your partner's farts, it could have some health benefits. And the good news for all of us is that that was debunked. And this is what happens when medical studies get released and either aren't tested, haven't been proven, or the news media misinterprets them or opts for a catchier headline maybe than one that reports the actual facts. So personally, I was very happy to hear that that one was not true. Another one, things that we want to believe, right? So I'd be much happier taking a hot bath personally than going to the gym. I've never been a fan of the gym, but the truth is that this isn't true either. This is one I really like to point out, especially like this time of year. Headlines like this about drinking wine and tea can help with flu, either speeding up the symptoms, those kind of things. But if you click through this sort of catchy clickbait article, what you found was a study that looked at eating more plants for flu resistance. And basically what they found is that a microbial product produced when you eat plant flavonoids is beneficial during influenza. And actually, all fruits and vegetables and most herbs contain an amount of flavonoids, but they can also be found in things like dry beans, grains, red wine, green and black tea. But essentially the rule is the more colorful a food is, the more richer it would be in flavonoids. So you actually would be far better off to be consuming fresh fruit and vegetables on a daily basis, rather than to be drinking wine or tea. This is another type of health information that we come across day to day, and nutrition labels can be confusing and often are to people. I know as I go through the grocery store these days, I often see bags of potato chips that say family size or sharing size or things like that, which is something I did not see. But people can struggle to understand what a serving size is, and understanding health information often requires a set of skills, including math, etc., to help understand what your intake is. Another way we can come across, so the examples I showed before are really examples of just health information that's out there that is accurate, but is misleading, right? So with the flavonoid and the wine and the tea example, you'd be far better off having fruits and vegetables, but I guess those other two are okay. It's not inaccurate, it's just not the whole picture. This is actually, I want to talk about a study where someone was taking advantage of how little the news media understands about science these days and press releases to actually do a fake study. And so this one, I apologize if the mention of weight loss here is triggering, but that's what they used. And I really like to highlight this because it was done on purpose. So this study actually just followed 16 people, 5 men and 11 women, between the ages of 19 to 65. And so for a pool for a study, 16 people is far too small to do any type of research with, especially if the study has not been replicated over and over with a larger pool. What they did was take half of that group, so 8 people, right? And they, one group followed this low carb diet, and the other group followed the same low carb diet, plus they had 1.5 ounce bar of dark chocolate daily. And then there was a control group. Oh, so there's 3 groups, sorry, who were instructed to make no changes to their diet. And they all weighed themselves each morning for 21 days. So again, 21 days is not very long. It's not really a good enough time for a study like this. And the thing about statistics is if you measure a large number of things about a small number of people, you're almost always guaranteed to get a statistically significant result. So what they did was measure blood pressure and cholesterol and all kinds of health things about them. And the one thing that they found was this weight. Essentially, the more tickets you buy by measuring all these things, the more likely you are to win. So they didn't know what the results would be when they started this process. The headline we got could have been chocolate improves your sleep or lowers your blood pressure. But they knew that when they did it, they were likely to get at least one statistically significant results. They then submitted that result to 20 journals, and multiple were accepted in less than 24 hours. So once those journals had accepted that, and again, this is the problem we may be aware of with how publishing journals and the issues with them work, they submitted a press release. And basically they did everything that you do in a press release to make it interesting for journalists to report on it. There's some punchy quotes, a hookish lead, and then a kicker. So the journalists don't really need to read the actual paper because they sort of boiled it down to these essential details and then did it. And then we all saw articles like this hitting the rounds. So the bad news is chocolate isn't bad for you, but it's not going to help you. It doesn't have any real health benefits. And I think I really pulled some other headlines to showcase. I've showed you some health information. Some are funny, some have been interesting. Some might have confirmed our pre-existing beliefs. Some might tell you what you want to hear. Don't bother going to the gym or eating vegetables, just have a glass of wine. But I really want to stress that some of them are dangerous and that making sense of health information is really complicated. So let's talk about health literacy. So here's a little Q&A. So get your fingers ready, click back to the window, whatever, because I'm gonna ask you a couple of questions to put your answers in the chat. So here's a little fill in the blank. 1 out of how many American adults reads at the 5th grade level or below? And just go ahead and put your answers in the chat. Let's see, 6, 5, 5, 10. Another 10, 35, 8, 7. One out of 5. So a couple of you got that right, it looks like. So yeah, it's a surprising number. People really struggle to understand, especially health information. It's one of the most enlightening things and scariest things I've encountered since taking this position. And here's another one. Americans read at the 8th to 9th grade level, so the average, but most healthcare materials or information is written at the what grade level? 12th grade. It's a good guess. 10th. So you guys were guessing a little higher, but most information is really written at grade levels a little bit too high. And what we know about easy to read health materials is that everyone appreciates them. So even if your reading level is significantly higher, when reading material they're not familiar with, everyone is happier to have more easy to read material, especially if you're reading it in the midst of a health issue. So let's talk a little bit about health literacy. And this is the degree to which individuals have the capacity to obtain, process, and understand basic health information and services needed to make appropriate health decisions. So one of the things we try to encourage people to do with people in libraries to do at NNLM is help address the health, the literacy in their community, as well as the health literacy. And we'll talk a little bit about how libraries can do that. So we talked about this a little bit before, but why we need health literacy is really complicated. Navigating through our current healthcare system really requires not just the ability to read, but also to listen and analyze what we're hearing and make decisions about information and in professional lingos that may be unfamiliar to many of this. So analyzing those relative risks and benefits, calculating dosages, communicating with our healthcare providers. This is super important in the midst of COVID, evaluating information for credibility and quality, and interpret our test results if you get online to look at your test results to understand what they really mean, and just to locate good quality health information. Some basic literacy is required. This is our ability, obviously, to read, write, speak, compute, and solve problems. But it also requires numeracy, which is basic math, calculation skills, for example, such as calculating our blood cholesterol and blood sugar, measuring medication, measuring medication doses, understanding nutrition labels, comparing health plans or prescription coverage. Like I talked about earlier, looking at 2 different types of healthcare plans that are available: eyeglass, eye exam plans, dental plans, etc. You're looking at your premiums, your co-pays, your deductibles, and you have to kind of guess or understand how much you are going to use your healthcare. Requires biology. People with limited health literacy often lack understanding or knowledge of information about the human body and the way it functions, as well as the nature and causes of diseases. So without this information, they may not understand the relationship between things like lifestyle factors and choices that we make and various health outcomes. These days, it also requires computer knowledge, which is always changing. We also requires cultural and linguistic competency. So culture affects how people communicate, understand, and respond to health information. So understanding and recognizing the cultural beliefs and values, et cetera, of the people that you're working with. Computer literacy. So how to get online and to look up things and to search that, how to use a computer. We use MyChart and my healthcare provider. Getting online and getting in there and looking at test results and things like that require a level of computer and digital literacy. Media literacy, understanding those ads that we see, the billboards, understanding new media, so that anyone can have a platform on YouTube and say whatever they want about health information is really important. Digital literacy. So you kind of get the idea. It's more than just one thing that we're talking about here. It's a pretty big skill requirement to be good at this. And there's some real costs for limited, limited health literacy. People with limited health literacy struggle to understand nutrition labels and the options for nutrition that they may encounter. They're also less likely to act on public health alerts, and that's something that we've really seen brought home to us in the last 2 years. They don't understand what they're seeing or why it's important or if it's relevant to them. They're also less likely to use preventative services, such as going to the doctor regularly, getting checkups, getting vaccinated for COVID, getting boosted, those kind of things. They're more likely to skip tests, and that includes things such as yearly blood work that you may need to be done, annual checkups that may be you need to have done based on your gender, those kind of things. They're less likely to adopt healthy behaviors. Those things include eating a variety of fruits and vegetables every day, including using movement, those kind of things. They may really struggle to manage chronic diseases such as high blood pressure, asthma, diabetes, HIV, those kind of things are more complicated because they lack that variety of skills we were talking about, including numeracy, math skills. They may misunderstand prescription labels or instructions. People often struggle when the medication says to take it twice a day to know that that really probably means 12 hours apart, things like that. Because they are less likely to use preventative services and to skip testing, They may have more emergency room visits. So healthcare issues don't become an issue until they're an emergency and then require a visit to the emergency room or some other type of care. And this matters because emergency room visits are more costly for them, but also because what could be something simple that would have been treated with as an outpatient experience may now require someone to be admitted to the hospital, meaning loss of time at work, struggle to find childcare. Those kind of things can have a cascading effect. And then more preventable hospital admissions. So the digital divide affects health literacy, and it really shouldn't be surprising that there's a digital gap for those who have low health literacy skills. This group has an increased risk for health disparities. Things like fitness trackers, nutritional apps, activity trackers, patient portals, those kind of things, which some of them, I guess, aren't specifically necessary for health, like the fitness trackers. There's other ways to know that you're walking a couple miles every day. But people with low health literacy are less likely to be able to use these devices and to understand them. And that includes things like electronic patient records, how to access those things, how to communicate with their physicians around scheduling. Test results now are often sent through those online patient portals. So how to get those, especially if you still don't have a smartphone or have poor internet at home. Also being contacted for preventative testing. Some of the online tools also have privacy issues, and if you lack digital literacy, understanding what the challenges are around those online tools can be a real challenge. Oops, I jumped ahead. And so in those cases, patients who perceive themselves as having a high ability to manage their health information may accidentally share information they don't intend to, or unknowingly share personal information they would have preferred to keep private. This also results in people being reluctant to admit their struggles with technology and ask for assistance, especially when it comes to health information. And so then they may not make use of the tools that are fully available to them. And I want to talk about who's particularly vulnerable for low health literacy. And these are seniors over the ages of 65, adults over the ages of 65. This population did not grow up with technology and may sometimes struggle with it. They are also a group who is being exposed to far more media than they were over the course of their lifetime. They see more media in a single day than they would have in a week or so when they were much younger. So they are being bombarded with that. Racial and ethnic groups other than white. And here in the United States, that is because of racial disparities and systematic oppression that have happened to exclude those groups from access to healthcare, as well as explicit mistreatment of those groups medically. There's a wide variety of historical mistreatment of Black, Indigenous, and people of color, as well as more current issues. Recent refugees and immigrants, again, those people may struggle because of language barriers, but also because of some of the ways that they have been framed or portrayed in recent political debates. They may be less likely to seek health or help for health information. People with less than a high school degree or a GED usually lack some of those skills that we talked about, including basic literacy, numeracy, et cetera, that are required to access those online resources or other information. And then people with income at or below the poverty level, this is because they may be forced to work jobs that don't provide health insurance and so aren't able to go to the doctor. They may also have jobs that don't allow time off for maintenance healthcare visits or don't provide paid time off in any format, may provide inadequate paid time off. So may either be providing very few amount of sick days or vacation days, may also be providing a pool of PTO, which combines sick days and vacation days. And if you're only getting 2 or 3 weeks of that a year, people are less likely to skip preventative health care visits in order to have a vacation. So there's a lot of practices that we do that can really exacerbate this. And then non-native speakers of English. Whew, that's a lot, right? So let's look at one example, and that's chronic obstructive pulmonary disease. And people with breathing problems, because they have COPD, have a lot of additional health, and it can have some additional health issues due to the lack of understanding of the condition and how to manage it. And what we see from people who have this is that they just can't seem to get relief. And so their life is overruled by their chronic disease. So here's some examples of the people with COPD with low health literacy. Inhaled medications are one of the primary ways they treat that. They may not understand how to use their inhaler or how to use it properly or when to use it. They may not understand when they need to seek medical help and may rather end up going to the ER or being hospitalized more often, depending on failing to get preventative treatment or waiting too long. Of course, then this adds to the cost of healthcare for themselves and the system we have here in the United States. They may just feel really helpless to be able to manage their own disease. They don't know what questions to ask to even get started to get a better handle on it. So they're actually 5 times more likely to go to the emergency rooms and 8 times more likely to be hospitalized, which again is problematic for everyone. So you're like, okay, it's bad, but why should libraries help? So let's talk about a couple of things that we know about libraries. First, in the US, public libraries are almost universally supported. Most people believe that they're vital to their community and community well-being. Of course, there are arguments and discussions about funding and materials and things like that, but overall, they're universally supported. Second, public libraries have a tremendous population outreach. There are more than 9,000 public library systems in the US. They basically serve 25% of the population, and about 50% of Americans visit a library every year. So there are very few other organizations, especially nonprofit, not-for-profit ones, that reach that number of people. Libraries play a critical role in promoting child and health literacy. So already libraries are involved in providing and promoting literacy. So keys to predicting health literacy are basic literacy. This helps with adherence to preventative healthcare services, etc. So I got that. And then libraries have long been a source of consumer health information. So these are places where people come to look up health information. Back when we all kept the Merck manual behind the reference desk, more often now to look on computers. A lot of those print materials have gone away, but they're trusted and people will often come to the library for help for finding information. Once we start looking at what happens when you have a healthier community through some of these initiatives, healthier communities have higher rates of education. It's a lot easier to get education, to take advanced education if you feel good, if you're healthy and able to do those things. There's also a stronger local economy. People who are healthy and well are not only able to report to work more often, but more likely to be entrepreneurs and innovators. If there's a local natural disaster, there is quicker recovery and less negative health issues overall, because that stress and mental fatigue that leads to the release of stress hormones through disasters can have a pretty negative effect on people's health. This actually, strangely, I think this is a really interesting one. Recovery after natural disasters happens more quickly. Probably more obvious, fewer chronic diseases may happen in healthier communities. And then lower rates of chronic stress and mental fatigue, so better recovery time, etc., which makes sense if you're not tired, if you're not exhausted, if you're not feeling well. If you're feeling well, you're going to be more likely to engage in activities that reduce stress and improve mental health. And then lower early death rates from things like diabetes and cancer. So how can we actually help? A recent study found that public libraries in the US advance equal access to health information in really important ways. 60% of public libraries surveyed help patrons identify health insurance resources. 58% help patrons locate and evaluate free online health information. 48% help patrons understand specific health or wellness topics. And some libraries even offer direct access to health programming. I think we've seen that number go up a lot more in the last couple of years. It's a safe environment to conduct health information searches. So it's a place where people feel comfortable and safe, either asking for help or looking for information on the shelves or doing online searches, especially for those who don't have access to technology at home. Health-related programming and outreach is something that we're starting to see more and more of in libraries, both related to physical health and mental health and overall well-being. There's a pretty wide swath of these, from mindfulness practices to libraries renting bicycles and things like that. And then libraries can also choose to model healthy behavior for their community with internal workplace wellness. And I teach a whole class on that, but I just want to touch what we're talking about when we say workplace wellness is not anything focused on weight loss or step count type programs. What we're talking about is truly empowering staff to make their own choices to improve their wellness. So talk about some programming outreach. A lot of this you probably are either doing or familiar with or have seen. So really easy is just subject guides on the website that in particular focused on health and maybe pulling out some databases and linking to resources directly. So I'm going to show, if we have time, I'm going to show a little bit of Medline Plus. And Medline Plus is great, and you can just link to the Medline Plus homepage. But one of the great things about Medline Plus is that there are sections within the website aimed at specific audiences, and you can pull those out and have multiple links to Medline Plus, each going to a specific page. You can check out fitness material to try options at home. This has gotten increasingly popular, especially around yoga and things like that. You can also do online streaming for a lot of these videos. You know, this screenshot is obviously getting a little old at this point. You can do services targeted to specific audiences. So this was one from Brooklyn Public Library that offer programs targeted to, you can see older adults, immigrants, jail and prison, etc. And so this includes things like films, performances, and education programs targeted to older adults. And some of that is based on, what time you have them and the location of services. Workshops and programs, just different guest speakers in your community. You'll often find that local health officials are happy to come talk to an audience or to have people to talk to. If you have it in your budget, in your programming budget, you'll find local, yoga businesses and mindfulness practices are also happy to come provide programming and outreach. One word of caution before you start considering doing or having guest speakers come in for health-related programming and outreach is to really carefully word a policy around that that excludes people or businesses that do direct sales. You don't want to have multi-level marketing companies coming in and pitching their products under the guise of health. Community partnerships. You'll often find that different groups love to come in and partner with the library. As I mentioned, all the reasons that you should do health outreach is all the reasons people want to partner with you. Different organizations like focus on diabetes and other things may have local or state offices who are interested in connecting with your library and doing programming. So don't feel like the programming you're doing around health would necessarily need to be led by a staff member who, especially if you're not comfortable with that. But also some of the most successful programming I have heard of in libraries was started by a staff member who has a particular interest in that topic or program idea. This was a really successful program, and it is one that can be copied. In 2017, this won a Library of Congress Best Practices honoree for this program. It actually was funded by the GMR, my office previously, several performance periods ago. But basically, these 1-hour programs takes participants on an imaginary trip to another country or region of the US. And so these are kits that could be either taken, like say, to senior centers by library staff, or could be checked out, and they include things like books, music, objects, folk tales, anything related to that region that's like engages one of the senses. And even books that are meant for children or teens that have pictures from that region, because what you're looking to do is stimulate the other areas of the brain for people with Alzheimer's and dementia. You can also get a lot of great ideas in the programming librarian. We have started putting in health and wellness related programs in there, and that's continuing to grow. The other thing is some tools to help you and maybe your patrons on your own search for health information. I'm as guilty as anyone of Googling my own health symptoms. I will admit that freely. So you may be familiar with one of these techniques. I think one that can be kind of fun is the CRAP method. So when you're looking for health information, you're looking for currency, relevance, authority, accuracy, and purpose. The ABCs is another easy one that we come across. So authority, accuracy, bias, objectivity, currency, and timeliness. One that I have seen be really popular when I teach a longer class on health and wellness in libraries is the trust it or trash it method. And it's a pretty easy this is a screenshot from the website. So who said it, when did they say it, how do they know it? And that might be easier things to remember than the other acronyms. I know that there are mixed feelings about those in different factions of librarianship. This is one I put together when I started teaching classes to libraries on health and wellness for patrons. And I just wanted a cool name like CRAP. And so this is kind of what I came up with, which is suspect. And this is for apps, health-related apps. So what are you seeking? What are you searching for in the app? Does this app do the thing you want or need? Or does it just sort of do it? Usability is, how is the app designed? Do you find it easy to use? Do the menus and icons make sense? Security, will you need to make an account? Does the app share your data with your friends? Does it share your data or sell it to third parties? What's their security policy? Is it easy to find? Is it written in plain language? Price, is there a cost for the app up front? Are there in-app purchases will you need a yearly subscription? Those kind of things. Take some time and read the reviews for the app. Not just look at the stars, but look at what other people are saying in their reviews, and not just reviews for the most recent version of the app, but even previous ones. Take some time to figure out who created the app. Is the developer reputable? Do they have a website? Is there a way to contact them? Those kind of things. And then timeliness, when was the application developed and when was it last updated? Is it getting regular updates? I'm going to leave you with some resources, hopefully that will help you in your search for health information. The first is Medline Plus, and I guess if anybody's not familiar with it, let me know in the chat box. But this is a free resource from the National Library of Medicine. It was launched back in 1998 with 22 health topics, and today there are over 1,000. Medline Plus doesn't create its own information, but rather gathers it from other websites. But these links that they're included, so it's linking out to other resources, they have to pass a strict set of criteria before being included. And so one of the reasons that Medline is so great is that, as librarians and information professionals, if there's a link on Medline Plus, other librarians at the National Library of Medicine have vetted that link first, right? This way you don't have to decide whether this is quality information. It's been processed for you. It includes topics such as diseases, but also things like disaster planning and school health. There's a great section on drugs and supplemental health, including herbs. And I always like to encourage people to go look up what the research actually shows about echinacea or other herbs like that we take around this time of the year for cold and flu. There are some good videos and tools in there about surgery and other things. There's information to help you understand your lab test results. And there's a medical encyclopedia. So this is a really great resource for people who are looking for that in the library. There's clinical information. There is easy to read materials. So if you scroll down to the bottom of the page, you're going to see some links, including a link to easy to read materials and health information in multiple languages. Those are good resources to have access to in the library. And I also would say our office, the Region 6 of the network of the National Library of Office, is available to help. There's some of the things that we can offer. I can help point you to additional, more specific resources on health topics you're interested in or for your community. We can provide training and educational opportunities. So I will be working with Laura over the next couple of years to provide specific training opportunities for Wisconsin. You can also access our website, and I will have all this to share with all of you after. We regularly offer multiple types of free online training. So we have guest speakers who come and present. So for example, the series I'm hosting is a variety of speakers right now on trauma-informed care in libraries. And those webinars are usually an hour long. They provide live closed captioning. They provide 1 hour of CE from the Medical Library Association, who provides our CE. And then they're recorded and posted on YouTube, and you can watch them anytime you like after that. The CE is good for a year after the recording is posted. So if you watch something 6 months after we actually hosted the live webinar, you can still claim continuing education credit for that. We also provide opportunities for funding. So if you have not, one of the good ways to stay up to date on that is to sign up for the newsletter I write for public libraries. It comes out once a month, and I will share information with you when funding is available. We offer funding for outreach programs, programming in the library related to health and wellness. We're especially interested in libraries who are partnering with other community organizations. And you can always reach out to me for just to share an idea and if I think is a good idea, that kind of thing, we'll work with you to help you write your application. So if you've never written one before, don't be intimidated by that. We're also working to build partnerships in your state. So something we're doing new for this performance period, and our performance period goes every 5 years, is we are putting together an advisory council for each state. So there is one for Wisconsin that's going to be looking at health issues in the state. That includes libraries, but it also includes other organizations like public health departments and other nonprofits doing outreach. And we can help connect you with them. So that is it. I will turn my video back on. I did not see any questions coming in the chat.
I'm gonna Bobby, if you've got a question, you can put it in the chat, or if you want to go ahead and just unmute yourself. So Bobby, I do get your newsletter, and I try to share opportunities through our biweekly bulletin that goes out to all of our members. But if people wanted to subscribe specifically to your newsletter directly, is there something you could put in the chat?
Yeah, let me grab this link real quick.
Something that my library in Iowa took advantage of, I don't know if you are going to be doing this in the future, you have some book clubs where you can actually, it's treated, I think, as a grant. You apply for it and you can get a supply of books that you can use for a book discussion on a health related topic. Some of them have been fiction books. There have been some nonfiction books. So it's kind of an interesting way to engage the community in a health literacy learning opportunity using a program, an activity that you normally do.
Yeah, I don't know. We're in the middle of updating that list of those titles. I don't know how it will look going forward. but I do expect us to have that again. Yes.
Right. Very good.
It was very popular. We did that for small and rural libraries, especially. Well, my internet is being very slow. It probably doesn't like that
Looks like there's a question or a comment. A local acoustic neuroma support group meets at our library because a previous librarian here had an acoustic neuroma. To your point of incorporating health needs of our own staff, excellent way to go.
Okay, here we go. Goodness. This is it's going to look like a very long link. This is the link for the newsletter that you can sign up for. I also include upcoming training, education, interesting or timely health news in that. It's a good way to stay up to date with what's happening. I'll link into our other trainings too. We are still not doing in-person training. I don't know if that's going to ramp back up for us ever. It's like anything with the government. I think we won't get that money back.
So you're just doing virtual trainings right now?
Yeah. Here's some of the ones you can see. We have some. I think we have a nice variety of stuff coming up. Some stuff on yoga and body issues and things like that. We also have some on-demand classes. So, for example, this one is one on collection management for health collections, and so information maybe on helping with a policy or things like that. So there are a couple of ways to take training opportunities from us. One are the webinars, live or recordings. Another one are these standalone on-demand training modules, and we're going to be rolling out more of those in the next year, in particular focused on public libraries and consumer health. And you can take those at any time that pleases you. And then we also do classes that are asynchronous online. We use a learning platform called Moodle, and those often run from 2 to 4 weeks on a variety of topics.
Bobby, one thing I was going to ask you about, I'm not sure if this is affiliated with you or if you are just a member. I think I've seen your name. I follow Libraries or Champions of Healthy Communities on Facebook. Is that a supported a channel that you provide content to, or remind me of the kind of the genesis of that?
Yeah, that's a group that Noah Lenstra from Let's Move in Libraries and I manage, and it's focused on anything sort of related to health and wellness in libraries. It's a Facebook group, so anyone can share links in there as long as it's related to health and libraries. It's great because you're getting health sort of from a variety of perspectives. Noah shares often about physical movement type things, and I tend to share more about health information type things in there. And I put that link in the chat too for those that are interested. Just be sure if you're going to join to answer the questions. I do try to keep spammers out. I found it to be a tremendous resource, and there are always opportunities for webinars and things like that posted there from groups, not only yours, but others that might be of interest. So I encourage you to take a look at that. And if you're looking for programming ideas too, I can see like, people are coming in sharing stuff or they're programming and outreach that they're doing in their library too. So it's kind of nice.
If there are no more questions, I would love to hear from our members offline about other topics you might like to see for webinars. We're happy to host them. We have a Zoom account now, and I think it makes it, sorry about having to change the platform at the last minute, but I do think the Zoom interface is a little bit easier for people. It certainly is for speakers. So we'll go ahead and conclude today. If you need to get a hold of Bobby, I believe she put her contact information in her slides. You will receive a copy of the recording as soon as I'm able to download it later today or sometime tomorrow. So if you need to use this as a point of reference, or if you weren't able to join us today and you're watching the recording, we're glad to provide that as well. Bobby, I want to thank you for giving us your time today and hope to work with you again soon.
Thanks for having me, Laura. I appreciate it.
All right, bye now.